Welcome. Thank you for joining us today. My name is Jim Fleeler. Today's topic is cleaning protocols to lower the risk of an outbreak. Our time frame today is approximately 25 minutes of education, followed by approximately 25 minutes of answers. Please be sure to submit your questions online during our presentation, and we will make every attempt to answer them before we leave today. For those of you that don't know me, I am Jim Fleeler, Vice President of Canadian Sales for Charlotte Products. I've been in the industry approximately 40 years and still continue to learn every single day, each time I talk to a customer and listen to their challenges and to trying to provide solutions overall. Today's discussion points. We're going to talk about common facts surrounding the risk of bacteria and viruses. We'll certainly talk about coronavirus, SARS-CoV-2, and a COVID-19 update, how the spread of viruses happen in our world today, understanding disinfectants and their labels, the protocols surrounding best practices of using disinfectants, the effective products and solutions that we'll suggest to assist you, the resources and information links available, and of course, live online questions and answers. A few opening remarks. Coronavirus is developing into a public health emergency of international concern. There's major negative effects on the stock market, retail, sports venues, hospitality industry, vacation industry, airlines, restaurants, hotels, along with manufacturing. Health agencies are all communicating and sharing ideologies for the first time at a rapid pace. Manufacturers of disinfectants and sanitizers are also ramping up inventories along with new innovations and disinfectant claims and research and development ongoing. There's an era of change underway. Robotics are now roaming the halls of healthcare facilities, educating people on preventative care. Drones are applying disinfectants from the air in higher risk areas. Street washer vehicles are applying disinfectants from the safety of the cab to ensure worker safety. The education sector have now set up virtual classrooms to teach online, avoiding cross-contamination and promoting student wellness. All types of public transit are revisiting long-standing protocol methods for cleaning and disinfecting and improving there. These changes and more are most certainly welcome and needed in today's era. Knowledge transfer. Given today's climate with the current SARS-CoV-2 or coronavirus and COVID-19 disease globally, shared insight and knowledge transfer has never been more important. According to medical professionals around the world, they indicate that the increase in communication and the level of collaboration among scientists has enabled research to move faster than any previous outbreak. This is good news. At Charlotte Products, we're committed to communicating, transferring knowledge, sharing resources, and providing solutions to shorten your learning curve on proper surface cleaning to ensure safe, healthy spaces. Our thought process. It is important that you do not panic. Be wise and vigilant. Ask for help from industry professionals. Today's webinar is an exact example of this. Prepare for today and tomorrow. Have the proper inventory on hand, extra inventory on hand in these times. Revisit your training procedures with your employees and every custodian. This is paramount and priority as every custodian is the frontline center of our defense. Increasing cleaning frequencies in these high volume contact areas and touch transfer points is critical. Be sure to keep in touch with the Center for Disease Control and the World Health Organization for extremely accurate and timely information. Pandemic facts. We have a long-standing history of a multitude of bacteria and viruses that have put us at risk. For centuries, we've been challenged with outbreaks. The World Health Organization stats in 2003, I'm sure everybody remembers SARS, that severe acute respiratory syndrome. In 2007, it was the avian influenza. In 2009, it was H1N1. In 2010, it was again avian influenza, cholera, and polio. In 2011, it was poliovirus, West Nile. In 2013, MERS, which stands for the Middle East Respiratory Syndrome, that is continuously ongoing and mentioned in several years. Ebola in 2014. In 2015, I remember it well, it was a Zika virus and the threat of mosquitoes and transferring that way. In 2018, measles made a resurgence, and MERS again, and also Ebola. In 2019, 2020, it's coronavirus and norovirus, which is still ongoing. And the question really is, what will arrive next? Pandemic facts. There's a deadly pandemic history that we've witnessed before. The Spanish influenza killed 40 to 50 million people back in 1918. In 1957, the Asian influenza killed 2 million people, and in 1968, the Hong Kong influenza killed 1 million people. Epidemics, pandemics, and outbreaks. The World Health Organization provides us with an influenza pandemic alert system that has a scale from phase 1 to phase 6. Phase 1 is a virus that's discovered in animals but has not caused any known infections in humans. Phase 2 is when an animal flu virus that has caused infections in humans. Phase 3 is sporadic cases or small clusters of disease that occurs in humans, in other words, human-to-human transmissions, but is insufficient to cause community-level outbreaks. Phase 4 is the risk for a pandemic is greatly increased but not 100% certain. Phase 5, spread of disease between humans is ongoing in more than one country. And in Phase 6, community-level outbreaks are in at least one additional country in a different World Health Organization region. And then you've got a global pandemic underway. Facts. Is there an exact coronavirus vaccine available today? No. Is there a registered disinfectant stating that it kills this exact strain of SARS-CoV-2 today? No. The EPA's emergency guideline allows manufacturers to receive special permission to advertise their products for use against emerging viral pathogens during public health outbreaks. The intent is to expedite the process for registrants to provide useful information to the public regarding products that may be effective against emerging pathogens. One update is as fresh as March the 6th of this year. This is why we need to educate people so they may have a better understanding of the situation and react. Training is paramount. All aspects should be prioritized. We cannot expect our medical scientists or industry to have a vaccine on the shelf ready to go. How would they possibly know what is coming, when it will arrive, who will be at risk, and what's coming next? Be at risk. The virus background, identified as coronavirus CoV, recently named SARS-CoV-2 with the associated disease being labeled COVID-19. You may hear several different names here, but they all relate. The thought is to have originated in China, believed in an animal to human transfer, has been the main cause. Name novel, in other words, standing for new, coronavirus appears to have crown-like spikes on its surfaces, and we recommend consulting with your local authorities, the CDC, and the WHO organizations for the latest and most accurate information. Social media such as Facebook or Twitter, unless validated, are not your best source according to medical officers and professionals for the most qualified and accurate information. SARS-CoV-2. The coronavirus is an enveloped virus, therefore deemed very easy to kill. It has a very thin shell around it providing some protection, but it can be susceptible to mild soaks. The SARS-CoV-2 virus, which causes the disease, now known as COVID-19, is such a virus. According to the CDC, Health Canada, Public Health, and similar agencies, any hospital-grade disinfectants that are registered with a DIN and EPA number will be effective, so by extension, we have 16 disinfectants in inventory today on the shelf that will be effective. Proper cleaning protocol using the correct registered product and procedures will reduce the risk of an outbreak and improve the wellness of your employees and visitors in your facilities. Technical bulletins. We have several available on our website at charlotteproducts.com. This one refers to the registered products with both EPA and DIN approvals that are effective against the virus. We have 16 available in North America today that can help you clean your facility in a superior manner. Today's world is mobile. People, produce, livestock, and a multitude of materials and goods travel anywhere across the world in as little as 24 hours. These items can be handled by thousands of people during their transport. Modes of transportation from rail, container ships, airlines, trucking, and package couriers. Can we spread a disease rapidly in this manner? Absolutely. I've been in the industry for almost 40 years and I fly over 100,000 air miles each year. I've been educating most types of facilities from healthcare, food processing, our education facilities, long-term care, and public transportation facilities. I've witnessed an array of people's habits, how they abuse facilities, leave them dirty, the overall cleanliness level declines, cleaning protocol, personal hygiene, eating, sneezing, coughing, and an overall lack of concern for their fellow people surrounding them. Washroom hand hygiene in public washrooms still astounds me today. The amount of people that do not wash their hands, attempt to wash their hands in about 5 seconds or less is quite honestly wrong. Today and yesterday's world. You would think that with all of the news surrounding coronavirus threat, people would take extra precautions. Some do this very well, some do not. It is a given that there will be new strains of viruses challenging us in the coming years. There is a risk of older strains of bacteria and viruses mutating and coming back, most likely stronger than ever. There are immunities to deal with. This is most likely why we do not effectively kill these types of bacteria or viruses, and they are adapting and becoming immune to our current methods of controlling them. Since we cannot effectively predict what strain is coming next year, the year after, etc., we need to understand the best ways to protect ourselves and our planet today. Understanding disinfectants. There are two key factors to consider when selecting a disinfectant. Number one, the overall efficacy level that infection control needs. In other words, what stated pathogens that it's required to kill. And number two, the overall detergency level that's needed to meet the needs of your facility and soil loads, regardless of light, medium, or heavy duty. Both go hand in hand. You need both complementing each other to achieve your facility's infection control and environmental custodial services objectives. Understanding disinfectants. No matter what type of disinfectant chemistry your facility selects, whether it's quat-based, sodium hypochlorite, bleach, hydrogen peroxides, or nano silver. Regardless of your choice, ensure that they either have an EPA or a DIN number on the actual label. This guarantees that if the product is used as per the instructions, it will kill the advertised stated pathogens, offering solid peace of mind of clean. You must follow the label instructions. For best results, you need to select the best registered disinfectants that has the best overall level of detergency to meet your needs. Then you need to educate your custodial team on the exact cleaning process in order to achieve the ultimate goal. Eliminate or lower the risk of infectious diseases. It sounds easy, but really it's not, as both long-standing and most recent studies indicate that up to 95% of our world's disinfectants are used incorrectly. That is a failing grade. Why is this? Perhaps we do not understand the severity of our situation or people in general, or we have a tendency to shy away from the perceived difficulty of disinfectant use. It really is not difficult. If you follow the instructions on the label, you will have a very positive outcome. Right. The other thing too is when we talk about and we're training in facilities, you'll find that people have always done it this way, so there's no need to change now, and really it's quite opposite for sure. Disinfectant labels. Everything you need is on the label. Everything on what the product is, the dwell times, whether it's a registered disinfectant, whether it's a registered sanitizer, all of the stated pathogens that it kills, any sensitivities and all of the efficacy and kill claims that are on there. Infection control needs to see that actual label, and all of the information required is certainly there. Disinfectant label instructions. A registered disinfectant label identifies that it is registered with either a DIN number or an EPA number. This means it's approved for use in any medical or healthcare facility, which should tell you that it has very good kill properties. You can verify all of these claims online quickly with your supplier or the manufacturer. It identifies what stated pathogens that it will kill. These are the most harmful and the most serious risk. It contains step-by-step directions for use, the way the product should be used, diluted, ensuring it's accurately diluted. That's surfaces that need to be pre-cleaned, how long the product needs to dwell on the surface, and if the product needs to be rinsed with potable water afterwards, usually in daycare centers and food processing facilities. A label will also state what ppm or parts per million that is required to ensure a disinfectant claim. This is done by using litmus paper to regularly test the actual ppm, like those who have swimming pools and hot tubs that test for pH and chlorine parts per million. The actual label itself as well. On average, very few label instructions are followed. If they were, we'd have fewer outbreaks and illnesses. Many disinfectants instruct you to keep a surface wet for up to 5 to 10 minutes, and this is most likely our downfall as it's most difficult to ensure. We should be extremely careful not to make rash decisions purchasing registered disinfectants that have the largest list of stated pathogens. If you don't have a risk of those pathogens in your facility, there's no sense over disinfecting because there's a reverse immunity there that will affect us in a negative way. Most disinfectants are poisons and toxins. They kill things. We can go ahead and nuke everything that we want, but the chances of us surviving are slim. And remember, approximately 98% of the world's bacteria is actually good for us. Less than 2% is a risk. We need to respect that. Let's learn to make wiser and safer choices and contribute to improved sustainability. What you should do. At Charlotte Products, we believe that if we safely remove organic matter and then sparingly, thoughtfully, and carefully apply disinfectants and sanitizers on those higher risk, high volume contact points, we'll be in better shape. Properly following the label instructions each time. We will lower our risks today and tomorrow with a goal of reducing the amount of immunities and antibiotic resistance in the future and assist us with more sustainable contact. Cleaning protocols and suggestions. Ensure that you educate your employees about the importance of proper hand hygiene. Mild soaps are effective, increasing the frequency of washing, the role that they play on the prevention of spreading contamination in the workplace and at home. The proper use of alcohol-based hand sanitizers when hand soap is not readily available. Ensuring that an ample supply of paper towels and toilet tissue is always on hand. Selecting the best disinfectant and understanding the correct use instructions and proper application, which surfaces to ensure that are cleaned. Which packaging best suits your facility? Is it a 946 or a quart bottle that is ready to use for personal spaces and smaller spaces? Is it a gallon that's ready to use and through a pump-up sprayer for larger coverage, or concentrated wall mounting dispensing systems? Conduct a hands-on training cleaning session, revisiting the proper steps to clean and disinfect higher risk areas within your facility. Facility areas such as washrooms, break rooms, treatment rooms, first aid rooms, and cafeterias. Effective products and solutions. Our Enviro Solutions 72, 64, 64H, and 364 dilution control program mirrors our beliefs of safely removing organic matter and then caringly, thoughtfully, and sparingly using disinfectants in those higher risk, higher contact areas. Some of the benefits of this cabinetry are it's safer and improves employee wellness. You have substantial claims against a multitude of bacteria and viruses, overall improved sustainability, lower costs, reducing the impact on budgets, extremely accurate dilution ensuring more effective detergency and parts per million count, produces a better overall clean, and it's not a question of whether you need dilution control or not, it is which system actually best suits your facility. Now we'll talk about the product benefits of EnviroSolutions ES72, 64, 64H, and 364. For pre-cleaning surfaces, we recommend ES72, which is a hydrogen peroxide formula, universal cleaner. It's very effective, it's safer, it has multiple dilutions and multiple cleaning applications. Then after using this, sparingly, carefully, and thoughtfully disinfect high-risk contact points using either ES64 or 64H, which is a quat-based neutral disinfectant that's effective for coronavirus, or ES364, which is our latest, quat-based neutral formula, and it has a norovirus kill claim in as little as 5 minutes for dwell. Between a choice of the two of these proven products, you can clean and disinfect up to 95% of a typical facility. More effective products and solutions is our latest Canadian innovative solution, which is out in March of 2020. Our ES15 spray and wipe disinfectant cleaner is ready to use. When you're not a candidate for concentrate dispensing systems on the wall and you have an immediate need for ensuring that anyone can use in any space throughout your facility, such as personal spaces, washroom fixtures, desktops, partitions, and touch points. This new registered disinfectant is ready to use, offering solid peace of mind and reassurance of accuracy. The dwell time of this ready-to-use solution is 5 minutes. However, it does not require a rinse unless it's used on food contact surfaces, so you may spray and go, improving disinfection and reducing labor time. It is specifically designed for facilities that do not have dilution control devices installed, are at risk of dilution errors, have lower volume purchases, and need a ready-to-use solution that's easily applied through a pump-up sprayer to immediately apply throughout your facility. Ready to go. We would also suggest having it on hand for any immediate outbreak threat or avoiding cross-contamination in any facility. Product codes are on the bottom right, and the sprayer code that we offer for sale is on the bottom right as well. Another one of our latest innovations that's available spring 2020 is for the United States. It's our EnviroSolutions ES16 that's also a spray and wipe disinfectant cleaner that is ready to use. The main difference between this and the Canadian version is that the dwell time is 2 to 5 minutes. In the bottom right-hand corner, you'll see the product code for quart bottles and gallon containers, and also the sprayer code that allows you to easily apply on the surfaces. Additional solutions to definitely consider. Our ServClean ready-to-use food contact sanitizer has a 60-second sanitizing claim. There is no fragrance or dye. It's exceptional in food prep and food processing areas, break rooms, cafeterias, exercise equipment, restaurant tables, chairs, commercial and residential kitchens, all employee workstations. It's applied in an apply and go application using a microfiber cloth. We'd recommend it in any public office tower, public building for those individuals to use in their immediate workspaces to provide a sanitizing claim. It's also been recently discovered that our sinks and our floor drains are a source of bacterial contamination. Our ServClean Drain CL treatment is easily poured into your drains, and the sodium hypochlorite solution is activated, producing a deep foaming action, killing bugs, fruit flies, and foul odors. This is a simple pour and go application. As far as cleaning validation, there's no better option than Optisolve. It's our digital imaging technology that's a very innovative program that allows any facility to adapt a precision cleaning program that identifies the high-risk contact areas that are often a source of contamination. Simply put, making the invisible visible. Cleaning professionals can easily clean and disinfect these areas, lowering the overall risk of a facility outbreak, lowering absenteeism and the associated payroll costs. You can see on the right-hand side what we generally see as a visual inspection, and you can see what the Optisolve digital imaging produces. So what happens is then the custodial staff can see the exact risk areas and precision clean those particular surfaces, again lowering the risk of infectious diseases. It's critical that you understand the additional resources that are available for you to look at that suit your facility. We've attached a variety here of links that you can simply click on that will give you the Center for Disease Control, the World Health Organization, the Biocides American Chemistry site, the Environmental Protection Agency, Public Health Services, diseases, things like that. So there's a large array of information that's out there, and these are ones that we recommend that you take the time to look at today. Now we'll get to the summary and questions and answers. We hope that you've found this webinar helpful and that you have a better understanding of the situation we're facing today. It continues to ramp up every hour of every single day. We're all in this together. Let's learn, adapt, and improve our cleaning protocol overall. Most importantly, you can contribute to a safer, more sustainable planet. We are available to assist you with your facility objectives upon request and recommend to do so. We thank you for your valuable time and interest today, and now we'd be happy to respond to your questions.
Thank you for all your submissions. Many of you have submitted similar questions, so let's begin. What is involved with using a disinfectant properly?
It's a very good question, Jen. You should always follow the exact label instructions for best results and peace of mind that you are controlling the spread of bacteria and viruses. Labels will always confirm that it is a registered product that's identified by an EPA or a DIN number that we've talked about earlier. The label will also include the exact dilution you should mix the solution at, the fact that you need to pre-clean surfaces, first removing gross filth, how long, in other words, the dwell time, the product needs to remain moist on the surface, and that if there's any product or surfaces that need to be rinsed with potable water. A rinse is always required when you may come into contact with food contact points or children's toys in daycare facilities and preschool. These steps are seldom followed properly, identifying an area that we can all contribute and learn together and to provide cleaner spaces.
Our next question is, what surfaces should I disinfect?
Another great question. We recognize that you cannot disinfect every single surface in your facilities or homes, and nor do you need to disinfect them all. However, we recommend focusing on those high contact touch points and food contact areas to avoid cross-contamination. Also keep in mind that floor surfaces are our largest reservoirs for droplets, contact from people's shoes, briefcases, purses, lift trucks, things like that, all possibly spreading and cross-contaminating bacteria or viruses throughout your facilities. Ensuring that you use the correct detergent and cleaner with the appropriate disinfectant or sanitizer is paramount. One example would be to utilize our EnviroSolutions ES72 Universal Cleaner, followed by either our ES64, 64H, or 364 disinfectants, or our ES65, 65H, or 67, which are all fragrance and dye-free disinfectants. These are the best line of defense. These products follow our direct belief to safely pre-clean and then caringly, thoughtfully, and sparingly disinfect or sanitize surfaces. We even have a precision dilution dispensing system available to ensure a better result.
Should I disinfect everything in the facility to be safe?
The questions are good. No. As stated in the webinar, some disinfectants are poisons and toxins because they kill things. On low-risk surfaces such as walls and ceilings, windows, whiteboards, and a multitude of other low-exposure traffic surfaces, we never ever underestimate the importance of safely and properly cleaning surfaces. This is a key step to a safer and long-term sustainable future.
Our next question is, what disinfectant is best to use?
We recommend always having an EPA or DIN registered product. You may find kill claims on the label, or you can research online exactly what the kill claims are as advertised. If you are in a healthcare or long-term care facility, you will have an infection control officer in hand that will tell you what claim or claims that they need to have. This is critical that you meet their needs to avoid outbreaks or regulatory compliance issues. Custodial and janitorial departments also need to ensure that the product has the correct detergency to clean the exact type of surfaces and soil loads within their facilities. We have several products to select from light duty, medium duty, and heavy duty cleaning levels, and a wide array of claims to ensure the proper result. These products come in free pour containers that require proper dilution, also in concentrates, and then also our latest in a ready-to-use container that you just may simply spray and go.
We received this question a few times. Should I dilute the dilution stronger than the label indicates due to coronavirus, and is this better?
Absolutely not. Never ever dilute or mix a disinfectant stronger than what the label indicates. This has a reverse effect on the end result, as it leaves residue behind and perhaps a biomass that can promote the growth of bacteria. It will usually leave streaks, visual streaks, which project a poor image of the facility and will cause resoiling rapidly, creating more labor. Infection control officers, accreditation science labs, the Center for Disease Control, Environmental Protection Agency, the World Health Organization, they've all had input into the approval process for what exact dilution it needs to be to ensure that it may address the stated pathogens in which the label says it's going to kill. Many facilities actually struggle with this. Think about it. If the label registered to kill the required stated pathogen is needed at a 1:64 dilution ratio, the result is exactly this. If the instructions are followed, diluting it stronger will not kill more pathogens. In fact, it results in overspending and a poor end result.
Should I engage my entire custodial staff, the employees in the facilities, with the cleaning protocol?
Employee transparency and awareness is critical today. They will have worries, they'll be stressed about the coronavirus and the social media out there, they'll be worried about their health and their welfare, and it's a serious situation. HR, health and safety teams should all be communicating and promoting that we need to be vigilant and ensuring our own personal workspaces are kept clean, disinfectant, or sanitizing, depending on the type of facility. How long does it take for each one of us to clean these areas, or clean up after we eat or drink, or even have a coffee spill or a soda or a pop spill? An important point to remember is that bacteria and viruses will travel in two directions, to your place of work and back home. The cleaner both locations are, the better off we all are.
Should I conduct documented in-house training sessions that relate to our employees in the workplace?
Yes, it's a proven statistic that written quizzes and documentation increase the learning curve, along with the retention rate is also higher for any employee. Be sure to consult with your service providers for the latest information that assists you with setting up educational training sessions. Your employees will feel more respected and that you care for their wellness when this occurs. We even suggest a short multiple choice quiz to ensure they understand and protect themselves. What?
Our next question is, where can I get the latest information about the pandemic or COVID-19 threat?
Good question. Okay, everyone's always looking for helpful information and the source of the best source to respond to. We recommend you go online to the CDC or the WHO organizations. There will be the best, the most accurate, and the most recent updates, providing global updates and the information that require you to stay safe.
If we can no longer buy alcohol-based hand sanitizers due to a shortage, what should we use in its place?
Wow, I've got to compliment the group for all these questions because they're actually good. They're good common sense questions, actually. Both the CDC and the WHO organizations, which we respect, departments of public health, etc., they all promote the frequent use of washing your hands frequently with mild soap. And I can't stress that word enough, frequently. This should be your first step to follow, even if you have alcohol hand sanitizer on hand. Wash your hands more often. Spend more time working up a lather in between your fingers and your nails throughout the day and the evening. Be sure to wash your hands thoroughly before and after you eat. Okay? If you come in contact with bodily fluids, then you should always use alcohol-based hand sanitizer or approved wet wipes and to avoid the risk of contamination.
The next question is, should we be atomizing disinfectants, trigger spray use, in other words, in the air or applying with a charge bucket or microfiber cloth?
Atomizing is frowned upon these days, more and more due to respiratory illness and eye and skin irritation. In fact, a lot of facilities for the last 4, 5, 6, 7 years have eliminated trigger sprayer heads and are going to this method. Our industry is obviously moving away from it. They're moving towards color-coded charge buckets and microfiber cloths that are color-coded. And since this is very important to respect and ensure, you've got to respect the label dwell times are met. The more mixed solution will actually keep the surfaces moister, extending the dwell time, reassuring that you've got the kill that you want to kill the bacteria and viruses that you're setting out to do in the beginning. Absolutely a better way to go, without question.
Would you recommend using a sanitizer or a disinfectant in my personal workspace?
Another question. Okay, another good one. Due to the fact that a registered disinfectant may need a longer dwell time, and there is not a large risk of bodily fluids, on the surface, or a large number of people working in that space. But you may be eating after lunch, having a snack, a granola bar or a sandwich or whatever, and we'd recommend at least a food grade sanitizer that will sanitize these surfaces for you with a quick wipe down in approximately 60 seconds. Wiping it with a paper towel or a microfiber cloth in the contact areas such as phones or keyboards, screens, desktops, armchairs, things like that will go a long way in the prevention of foodborne illness, even salmonella or E. coli, etc. There's no fragrance or dyes added, so you won't be you'll be avoiding complaints with your coworkers in the area. And we offer our Serve Clean Ready to Use sanitizer that's in a 946 ml bottle. It's ready to use. It has no fragrance or no dye. Simply wipe your surfaces down 60 seconds. You've got the peace of mind of a 99.99% sanitizer, which if I had a cubicle in an office tower or office building, that's exactly my line of defense that I would be doing.
Something that happened this week when it was declared a pandemic here. When the WHO declares a pandemic, what does this mean in simple terms?
Simple terms. Geez, well, that's a simple way to answer, actually, if it's simple terms. It means that this is now recognized as a worldwide threat and concern for public health, and they encourage countries to communicate more, to work together to provide solutions to the present risk at hand. And this risk is changing every minute, every hour of the day, without question. Countries will ramp up their cleaning protocol. They'll provide and declare their stats to other countries so they can all share the same common information and risk level and come up with solutions for that. They'll suggest corrective and preventative steps, when to have a travel ban in place, perhaps self-quarantine and things like that. Governments will also usually release special funding to the most vulnerable people in facilities providing assistance. The CDC and WHO are your best source and best resource to educate yourself.
So it sounds like we should actually have the CDC and the WHO regularly open on our computers or our digital devices to ensure that we're updated regularly.
Yeah, without a doubt, Jen. In fact, some of the people around the office here that I'm in, they have it as their screensaver, that are pointing out the hot spots and the risk areas and the updates on recovery and also contaminated people and quarantine efforts. So, and also you should keep an eye with it being March break and vacation, spring break, and things on cancellations of travel to countries, to vacation destinations and things like that, and what protocols in place. What you'll find is that the air carriers, the major air carriers, are even allowing, and this is amazing because when they allow it, it's a stressful time, is when they'll offer you to change flights without a cancellation. That's a pretty good example of a serious situation without question. So yeah, that's exactly what I would say there.
And we have time for one more question. Should I stay home if I'm feeling ill?
That's a good question. You should always do that for sure. And what we'd like to state here, what we should state is that you should always consult with your HR department and follow their recommendations. Keeping them up to date with your individual health is never, ever a bad idea, whether there's a pandemic or an epidemic or it's a seasonal avian influenza outbreak or whatever. Always involve them, and you'll never ever go wrong by doing that. Okay, so that is all the time. We still have a multitude of questions that we could answer, but out of respect of everybody's valuable time, we didn't want to run over. What I'd like to say is a sincere thank you for joining us today. We are available on a continuous consulting basis through a multitude of from the website to our sales force on the street across North America, from our deep facility specialists. We'd certainly recommend you reach out to us at any particular time. One thing that I will like to add is one of the largest phone calls that we've had this week is how's your inventory level? What's your inventory level? Look, if I place an order, are you going to be able to fill it? Well, what we can tell you is we don't run a manufacturing or production facility on speculation. What we recommend you do is you put your orders in the system, whether you're a new customer or existing, and then you're in the queue, and then you're prioritized every time. One thing I can tell you is a disinfectant typically has a shelf life of 1 year. All of our other cleaners have a shelf life of 3 years, so there's no risk of it expiring or running out. You're going to use it without question, right? You're better to have more than less, particularly here, because quite honestly, the experts across our globe do not know when this will if this will be short term or this will be long term. It could go on 2 months, 2 years. We just don't know. So you're better to have more. If we're running our production facilities overtime, we're running them double shifts, we're running overtime, weekends, things like that. We still have a good supply of raw materials that will allow us to manufacture finished goods. But my advice to you is place your orders today, because then you're in the queue. There's already shortages of towel and tissue and shortages of hand sanitizer. I'd be wrong to tell you that there may not be problems with disinfectants or sanitizers as we move along here in the coming weeks. So you're going to use it. Place your orders for sure, and let's all be safe and work together. Jen?
Thanks very much, Jim. I appreciate all of your insight and your knowledge, and transferring that knowledge to our listeners is key, and hopefully we've been able to provide some valuable insight, and we'll be here to support you in whatever need and capacity it is you need. Thank you very much for attending, and go safe.